Patient satisfaction survey is all part of patient and family-centered healthcare. We are here for the patients, we're here for the families, we're here for those people who do the heavy lifting and who are part of the uniformed forces and the beneficiaries and the retirees. We're going to continually improve the process. We can only do that by hearing from those folks who we take care of, who partner with us in healthcare. We look at it as part of the provision of care that makes you who you are and makes you strong as a fighting force, makes you strong as a family to support the fighting force, and makes you strong as those retirees who've left a legacy for us to follow. There is nobody more interested in this world in fixing your concerns and making your healthcare experience better than the men and the women and the professionals who are suiting up to take care of you in a healthcare environment.
The patient satisfaction survey covers a number of things, including wait times, how pain is being managed, whether medication is being discussed properly, access to care overall, also whether the providers are providing the kind of care that the patients actually need.
You have to think about what's coming up in the future. You could be in for 10 years and not realize it. 13 years down the road, you could have 2 kids like I do. And who's going to take care of them if I wouldn't have taken the minute to fill out a survey to change what's going to take effect in the future?
When I know my Marines are taken care of, a lot of stress is taken off me as a leader. When service members know their family members are being taken care of by the medical system, there's less stress on them and they can focus on their job at hand.
Whether we are young or old, active or retired service members, we owe it to ourselves to give this feedback. If we do not take care of each other, then we would not be in top condition to take care of the country on a whole. So the physicians owe it to themselves, owe it to the public, to make sure that we're in tip-top shape.
The reason that I am in healthcare, the reason that I have been a nurse, I'm an advanced practice nurse for 30 years, is because I exist for you. Without you, I would not have a life calling, I would not have a job. We exist for patients, and that is very clear, and that's why we want to hear from you, because without you, we really have no reason to be here.
We know that you might feel like you're inundated with surveys. TRICARE is surveying, all the other services are surveying, but we really want you to take the Navy Medicine Survey seriously. Please take the time to fill it out. It is very important to us, and we do use it for decision making.
Patient feedback is really critical for what we do as providers. We spend a long time going to school to learn the techniques and the procedures that we need. But really, the rest of our career is spent figuring out what we do well and what we don't do well. And the primary means that we do that is getting feedback from our patients.
The patient satisfaction surveys give us a voice. So take a couple minutes, fill out a survey. Even though you might think it's a waste of your time, because it really is not. There are people that are listening, and they want to hear what you have to say.
You make a difference when you suit up in uniform for this country. Let us make a difference for you by telling us what you think works well and what doesn't in our healthcare system. I have charged my people to do that. You have my word they will.